Here are the top 3 myths in any surgical medical malpractice case. Myth number 1, your doctor's going to tell you that you're going to be good as new in 6 weeks. Well, the truth is you're not going to be good as new in 6 weeks. You've had major surgery to a part of your body, either your back or your neck, and it's going to take months and months for you to feel good again. Why is that? Because your body's been traumatized and you're not going to be able to heal yourself in 6 weeks. So if the doctor tells you that, just remember, that's myth number 1. Myth number 2, anytime you have some kind of complication, let's say you have severe nerve damage down your leg or severe nerve damage down your shoulder and your arm after the surgery, you're going to be told, well, that was just a risk of the surgery that couldn't be prevented. That's myth number 2. Of course, there are risks of surgery that are not preventable, but there can be instances of medical malpractice where a doctor hits a nerve and they shouldn't have done that. And the reason now that you have numbness and tingling in your neck or down your leg, it's not because this was a non-preventable risk of surgery. This could be from medical malpractice. Myth number 3, anytime you have some kind of complication, you're going to hear, well, you have a lot of scar tissue in there. Yes, there are patients who've had many surgeries and they develop scar tissue, and scar tissue can make an operation much more difficult because that's very hard to get through and there's a lot of cutting involved. However, doctors often use this as an excuse to make the patient think that somehow it wasn't the doctor's fault, that it was the scar tissue that caused the injury. It happened, not the doctor's negligence. So that's myth number 3. So now that you know these 3 myths, anytime you're confronted with them, you'll know the truth.